Hello everyone, I am Dr. Seema Thakur, working as a genetic and fetal diagnosis expert at Fortis Hospital, Shalimar Bagh, New Delhi, and I have my own clinic in Dwarka. So today I would like to discuss about the deafness and its problem and its prevention. Deafness is one of the commonest causes of the disability, accounting for 20% of the cases of the disability. And as per the WHO data, about 7% of the Indian population is deaf, and out of which 1/3 are children only. So, as you know, deafness can cause a significant physical handicap in the children and hampering their personal as well as the professional growth. And for the adults also, this is a significant handicap, this leading to the cutoff from the world. So, it is high time that we let's know how we can prevent and how we can treat this condition, so that to make them as a effective members of the society. So, the national program for the prevention and control of the deafness was launched in 2008 with an aim to empower the people with deafness and also to prevent the deafness, the preventable deafness by 2030. And there are various aspects of prevention. One is the primary prevention, which means we prevent the factors which can cause the congenital deafness, and the most important of that is the infection by the rubella and the cytomegalovirus in the pregnancy. So, the rubella is preventable through the vaccination. So, I would urge that whoever is planning the pregnancy should take before pregnancy rubella vaccination. The another common cause is the cytomegalovirus infection. There is no effective vaccine available for this, but still this is preventable by practicing the COVID-like hand hygiene practices when you are handling, particularly when you are handling the kids' stool or the urine. Then the another way of preventing is through the genetic testing, the carrier testing, and this will identify the prospective carrier couples, and when both couple are carrier for a particular gene causing deafness, the prenatal diagnosis can be done at about 12 weeks of the pregnancy. Then we come to the early diagnosis and treatment, and here comes the important role of the audiologist, pathologist and speech specialists who help us in diagnosing the various types of the deafness by doing various audiometry tests as per the requirement of the patients, and they are also effective in conducting a very effective speech therapist. So, they are a very important part of the prevention and the management of the deafness in the society, and the collaboration with the genetics and the speech specialist and audiologist pathologist is very essential to reduce the burden of deafness in the society, because these audiologist pathologists can help these families, those who come into contact, and they can direct them to us for the genetic consultation and genetic testing, and thus the the prevention in the next child of the people who have a first child with the deafness. So, I suggest all of you to help in the prevention of the deafness through the vaccination, through the COVID related hygiene practices, and if your first child has got deafness, then the genetic testing can help in the next pregnancy. Thank you.